Hi, I'm Garvin Lynch and welcome to Lynch's Pharmacy Health video series. This video is on oral and dental problems. Oral and dental disorders can be broadly categorized into two different areas, those affecting the teeth themselves and those affecting the oral mucosa in the areas around the mouth. In terms of the teeth, the main issue is going to be a simple toothache. Usually a continuous throbbing pain in the tooth. It can be caused by a variety of different triggers. It might just be simple sensitivity, especially made worse by hot or cold things or sweet things. It could be a dental abscess, which is an infection in the tooth. It could be a loss filling, maybe a broken tooth. A whole host of things could cause it. In contrast, a localized pain in a tooth socket a couple of days after having an extraction could be a sign of a dried socket. Signs would include being very tender. Signs of a broken down blood clot include dry or even fresh blood around the area. No signs of healing or very poor healing, and there may even be some bone showing through. So as well as the teeth themselves, the supporting structures of the teeth, i.e. the gum, can be infected by a whole variety of things as well. There are two main ones. Firstly, gingivitis, which is more commonly known as gum disease. It is caused by plaque in between the teeth and the gums, which causes inflammation of the gums and bleeding, especially during or after brushing your teeth. The other main disease affecting the gums is always the next stage of gingivitis, called periodontitis. Gingivitis affects the gums mainly, whereas periodontitis spreads further and affects the bone surrounding the tooth. So signs would be bleeding of the gums, but also recession of the gums, causing more of the tooth to be seen because the gums are dying off as well as the tooth becoming more mobile. It might become looser in the socket and may even fall out if the problem is left go on long enough. Gingivitis is reversible with very simple treatment, but periodontitis isn't, and it's really all about damage control with periodontitis and trying to reduce how much gum or even how much tooth is lost. So it's important to get treated before it gets to that stage. Gingival overgrowth is an unwanted side effect of some drugs, especially phenytoin, which is used for epilepsy, cyclosporin, some calcium channel blockers, especially nifedipine, which is often used for angina. It's basically swelling and inflammation of the gums, not too unlike what's seen in gingivitis. Moving away from the teeth and onto the gums and onto the mucosa and the areas around the mouth, herpetic infections are quite common. So infection caused by the herpes virus. There are two main types. The first is seen in children and is just a primary acute infection, often confused with teething. So the child may be unwell, very irritable, the gums are going to be fiery red and very tender. That's why it's often confused with teething. There may be vesicles around the mouth, similar to cold sores, or they may burst to leave an ulcerated area around the mouth. The second then is an extension of the first one. So if a child gets a herpetic infection, it generally hangs around in the body and can flare up from time to time throughout their lives as teenagers or adults. And it could flare up as a cold sore, basically. So cold sores appear as vesicles just on the surface of the lips, and they are usually burst after a couple of days, leaving a raw area. Then they crust over. This happens over a period of 7 to 10 days from when they first appear to when they finally disappear. So the two main herpetic infections you can get in the oral mucosa are primary acute one in childhood, which then hangs around and flares up throughout the patient's life as cold sores, which is the second herpetic infection. Dry mouth is another common problem. Again, often due to drugs like some antihistamines, which drugs used for Parkinson's disease, and some antidepressants. A patient with a dry mouth is far more prone to infections, even cavities, and bad breath as well. The medical term for which is halitosis. Ulcers are obviously a very common problem and is often recurrent. It usually occurs as small cracks around the mouth that can easily become infected and usually appear with a yellow flap of skin covering them. Finally, then, thrush is a pretty common complaint of the mouth, especially in young babies, but can occur in adults as well. It usually involves soreness of the mucosa, and the tongue or the areas around the mouth would be covered in a white plaque. If you scrape away this white plaque, it leaves a very raw, bloody area underneath. It's very common in babies and young children, but also often seen in adults taking antibiotics or steroid inhalers. Oral and dental treatments. So in terms of treating problems in the mouth, if a patient has lost a filling which is causing a toothache, there are temporary fillings available where the patient basically mixes together the ingredients and forms a thick paste. Then the patient pops it into the cavity. It is important though to emphasise that this is temporary until they can go to the dentist in order to get a proper filling replaced. For sensitive teeth, there are sensitive toothpastes available, Sensodyne being the most well-known one. If there is excessive sensitivity and it's really bothering the patient, they probably have a cavity, so go to a dentist for referral. For just a general toothache with no clear cause, there's not a whole lot you can do besides go to your dentist. Painkillers tend not to provide the amount of pain relief that a patient would like, but if they're going to try it, which they probably will, it's best to try a non-steroidal anti-inflammatory drug, for example Nurofen, which is ibuprofen, and these tend to be good for sort of pain like dental pain. The usual rules apply for this class of drug, so not to be taken if the patient is pregnant, if you have a history of stomach ulcers, or you're asthmatic. Some people say that holding a dissolvable aspirin tablet just to the side of the gum that's causing bother helps, but it doesn't, and if it doesn't, the patient could end up with aspirin burn on their gum, so this doesn't work. If they want pain relief, take the tablets, but holding aspirin to the gum doesn't work. If there's a lot of bleeding after an extraction, it can often be treated just by using pressure, so biting down on a padded gauze can help. However, if it just won't stop bleeding, they might need a referral back to a dentist for packing and stitches. In mild cases of gum disease, Corsedin mouthwash or Oral-D is another one, are often enough to treat it. So for gum disease, a mouth's regime of using it twice a day, so morning and evening, is generally recommended. Usually for Corsedin, if you use it beyond a week, there's a chance it could stain your teeth, but the dentist can just remove this quickly with a simple cleaning. For dry mouth, there are salivary substitute preparations. Biotene do a range of products that tend to work pretty well for people. Basically just replace the saliva in the mouth, and by treating dry mouth, you're reducing the chances of cavities, infections, and often solves bad breath as well. In terms of ulcers, if the patient has a long history of them or they are recurrent, they haven't been checked out before, they should see their doctor. It could be a sign of deficiency like vitamin B12, iron or folate, some sort of deficiency, or indeed indicate something more serious going on in the stomach. If they have been checked out before, or if it's just a once-off, you can get symptomatic relief from preparations like Anbesol or Bonjela, which basically coats the ulcers. The Bonjela has a painkiller in it similar to aspirin. Corsedil can offer a lot of relief from ulcers. For cold sores, Zovirax is the main one. There is now a generic available which is cheaper called ASEC. The important thing about Zovirax is that once you start using it, as soon as you feel tingling in the lips, before any vesicles appear, use it for 4 or 5 times a day and starting as early as possible, because it's far more effective getting it before it appears on the lip. In terms of thrush, it's a candidal infection which can be treated using Dactarin gel. It is the best over-the-counter product that you can get. It's important to keep using it a couple of days after symptoms have disappeared, just to make sure the infection is well and truly gone. So obviously the best treatment for anything is prevention. So the importance of good oral hygiene cannot be overstated. Brushing and flossing are still the best way to prevent any problems we've discussed above, and as well as paying attention to your diet. So try to avoid or reduce the amount of fizzy drinks or any foods with a high sugar content. Paying a little bit of attention to these goes a long way to preventing any of these oral or dental problems. If you have any questions, contact me through the live web pharmacist on the website. You can email me or call into the pharmacy in Broaddale and Douglas. Thank you for watching.